Now let's have a look at the parotid gland and its innervation and see if there's anything how we can, well, kind of compare and contrast it to the other salivary glands we have. Our parotid gland is right here, so we actually have two. We have one on the left side and one on the right side. The innervation of the parotid gland is different. It actually comes originally, the parasympathetics at least, come from the glossopharyngeal nerve. The other two pairs of glands that we have are going to be the submandibular gland and the sublingual gland. The cranial nerve that is responsible for the innervation of the submandibular and sublingual glands is actually cranial nerve number 7, the facial nerve. And the ganglion for this is called the submandibular ganglion, as you can see here. The submandibular ganglion is hanging off of a branch of the trigeminal nerve called the lingual nerve. And so along the lingual nerve, which is actually from trigeminal, as I said, you have the parasympathetic fibers. They're presynaptic. They then reach the submandibular ganglion synapse here, and then they travel to the submandibular and the sublingual glands. Well, so if you have a parotidectomy, you still have one parotid gland on the other side, unless it's been done bilaterally. That's unlikely. And in addition to that, imagine if you had a lesion in the glossopharyngeal nerve that would lead to the lack of parasympathetic fibers, just in general. Well, you still have parasympathetics come from the facial to the other two glands that you have as a backup. Okay? So, in a nutshell, your secretory fibers to the parotid gland will come from parasympathetic components of cranial nerve number 9, the glossopharyngeal nerve. So, if I now have a look at this picture, why don't we see if we can illustrate that? Here is the glossopharyngeal nerve. The tympanic nerve will contain, here's the tympanic nerve, the visceral efferent fibers that are destined for the otic ganglion, which is over here. The tympanic nerve will actually enter the tympanic cavity through a tiny canal, which is called the tympanic canaliculus. And when it's in the middle ear, so before it continues, it'll contribute to something called the tympanic plexus right here. After the plexus, the tympanic nerve will become the lesser petrosal nerve, briefly, and that leaves the middle ear through its own little hiatus. The fibers will then synapse in the otic ganglion, where they become postsynaptic, and now comes the interesting part. These postsynaptic secretory fibers will then hitch a ride on the auriculotemporal nerve to reach their target organ, the parotid gland. Okay, so if we look over here, let me see if I can minimize the picture. So if you look over here, here's the parotid gland. Okay, there are many nerves that are traversing it. These are actually, most of these are going to be branches of the facial nerve. Here is the auriculotemporal nerve. This is the nerve on which we will have the fibers that are heading to the parotid gland synapse. As the name implies, it is close to the ear, aka auricle, and the temporal region. So that all makes sense. As usual in anatomy, the nomenclature kind of gives away what the big deal is, right? Now I'm going to zoom out here a little bit. All right, let's look at the other side. And if we look all the way up here, we can see there is an opening or a foramen, right, through which the facial nerve comes out, right? The facial nerve comes through the stylomastoid foramen, and then it'll fan out and go through the parotid gland. So you can imagine during a parotidectomy, the surgeon has to be careful not to damage any of the branches of the facial nerve. All right. So you have a mnemonic for the different branches of the facial nerve, which would be 10 zebras bit my cheek, which basically stands for the distribution region of where the respective nerve fiber is going to. So if you say you have a temporal branch of the facial nerve, I should actually highlight here, there'll be temporal branches of the facial nerve, so 10. Zebras would be zygomatic branches. Bit are buccal branches, here for instance. My are marginal mandibular branches, and cheek, C as in cheek, would be the cervical branches that innervate the platysma muscle. Okay, all of these branches are important because if you damage the facial nerve, you will lose the muscles that are innervated by it, and in people that have had a parotidectomy, it can take a couple of months for these fibers to grow back. So let's have a look at this diagram again. And the mnemonic, which is going to show up on your screen, is going to be GLOAPS, G-L-O-A-P-S, glossopharyngeal, lesser petrosal, otic ganglion, Oracutimporal Nerve, P for Parotid Gland, and S for spit. Throw in a few clinical correlations while we're at it. We'll start off with the parotid tumors. Okay, parotid tumors are usually benign and slow growing. It is rare that they grow to the size as you can see here in this individual. There's some potential for them to become malignant, but most of the time that is not the case. So pain or involvement of the facial nerve are signs that it's malignant, and the investigation is best done with an ultrasound scan. Yep. You can see actually here, this is now a CT scan, but already with an ultrasound scan you can see if the parotid gland is abnormally large. Okay, so the pain of a parotid tumor may often be referred as well to the TMJ via the oracutimporal nerve. So the oracutimporal nerve is over here, and if you have irritation of the oracutimporal nerve, as this is primarily a sensory nerve coming from the trigeminal nerve, you can imagine that that is going to refer pain to the temporomandibular joint. In addition to that, this nerve also carries the secretomotor fibers. Okay, so here you see the adult with the parotid tumor. That is a massive tumor here. And here is a CT scan, as you can see where the white arrow is pointing. This is a pretty large parotid tumor as well, prior to surgery, of course. Speaking of the parotid gland, why don't we throw in another clinical correlation, which would be mumps, right? Mumps is a very acute and actually also a very painful viral infection of the parotid and or the submandibular salivary glands. This can affect both children and adults, and you typically actually have several days of fever, headache, and muscle aches, maybe also tiredness and loss of appetite, followed by swollen salivary glands. Here's your parotid gland, there's the parotid duct, here's the submandibular duct, and the submandibular gland, and the sublingual gland and ducts, right? So mumps is really, really painful, and so opening your mouth is going to be severely restricted. You can see here this individual and this one here, they have big swollen cheeks. That must be very, very painful. This is an adult, this is a child here. This must be quite excruciating because the parotid gland also is embedded in a parotid sheath, which is really pretty tough and it doesn't allow for a lot of distension. So you can imagine how much pain that'll cause due to the compression of the surrounding nerves, right? So luckily it is very rare to get mumps nowadays if you live in a country that immunizes their population. Thankfully, mumps is very rare because most countries, or most civilized countries, should I say, they actually vaccinate, and that is part of your MMR vaccination. The mumps, measles, and rubella vaccine, no, it doesn't cause autism. That is a false information, so make sure you always get your vaccines in, all right? If you are not vaccinated against mumps and you contract it as an adult, that is pretty unfortunate because it can actually lead to reduced fertility because you can get inflammation of the gonads as well. Now let's talk briefly about what happens if you have the facial nerve or parts of the facial nerve that suddenly do not work anymore. So in that case you will be talking of a facial nerve palsy, and sometimes people call this, or variants of this, also Bell's palsy. Okay, here's your intracranial portion of the facial nerve. Okay, then very importantly you have the chorda tympani, which is this little branch that comes off of here, and it will join the lingual nerve, which is part of V3, or the trigeminal nerve. The lingual nerve will then go to the tongue, but it is taking with it fibers that have actually come from the facial nerve. And these fibers are going to be taste fibers, but also presynaptic parasympathetic fibers. Okay, the facial nerve comes out of the stylomastoid foramen, so it's a hole between your styloid process and the mastoid process, right? That's where it emerges. And you can see that the branches of the facial nerve go all over the place. Remember, here's a mnemonic: 10 zebras bit my cheek. So 10 zebras bit my cheek stands for temporal, zygomatic, buccal branches, marginal mandibular branches, most likely these here, and cheek is cervical branches. They mainly go to the platysma. Okay, so the facial nerve will provide motor innervation to the muscles of facial expression. In addition to that, also to the posterior digastric, the stapedius, which is a tiny little muscle in the inner ear, and the stylohyoid, which, as the name implies, goes from the styloid process to the hyoid bone. If we have a lesion to the facial nerve, you will have, or you are likely to have, a decreased salivation. That is, if this involves the chorda tympani or anything in that vicinity, because the parasympathetic fibers will have come via the chorda tympani. These parasympathetic fibers will join the lingual nerve over here, and then dangling off of the lingual nerve is going to be the submandibular ganglion, which I sometimes call a danglion, like a dangling ganglion. I at least find that is funny, and that is where the synapse occurs. So with facial nerve palsy, the lesion of the facial nerve, it might be that you end up looking like this individual here. This person is not trying to make a funny face. He's actually trying to pull up the corners of his mouth and kind of scrunch up his face on both sides at the same time. However, the right side is completely flaccid because he is suffering from unilateral facial nerve palsy. Okay, so remember that the facial nerve does much more than just innervating the muscles of facial expression. So you might also have a loss of taste, or unilateral loss of taste. That means you would actually experience it as a decrease of taste. Decreased salivation because you might denervate the submandibular and sublingual glands. You might also have a decrease in tear secretion because the lacrimal gland is also innervated via branches of the facial nerve. Okay, so this can happen idiopathically as well, so without a known cause, and then it's called Bell's palsy. Yeah, so that means you suddenly wake up one morning and you have a loss of muscles of facial expression. They're all slack, but over time, gradually, they will return little by little. Other causes potentially for facial nerve paralysis or palsy will include stroke, damage to the facial nerve during surgery, that could be dental procedures or parotid gland surgery or submandibular gland surgery. Okay, so one more time, this person is exhibiting facial nerve or Bell's palsy on the right side. This person is showing Bell's sign. See, he's actually trying to close his eyes, but the right eye does not close, and in addition to that, this is Bell's sign, so he's unable to close this eye, and the eyeball is actually rotated upwards.